when you start PT, you want to help people. Like my motivation to run the business was like, I want to help people on a grander scale.
What got you to work hard? It sounds like you're a workaholic, man.
So with needling, we're trying to like kind of expose that system and change that, at least from the neurophysiological perspective. What's up, it's Dr. Rob. All too often, I see people when they're shrugging, everything's to the side and they're just coming up like this, right? Everything is really compact.
What's up, guys? Another episode here at Empire is the Way. I got Dr. Rob Polizak, and he is the head and owner of Physiologics in Elevation right now. He's been in business for 5 years, doctorate at 2017 from University.
Yeah.
And he's here to teach us all about the body, physiological, and everything to go, man. Thank you for coming, bro.
Thank you, man.
Absolutely, man. So you graduated 2017 What was that like?
Well, you know, upon graduate, I've been in Miami for 3 years at that point, but I didn't really know what Miami was really like because when you're in school, it's like a whole different ball game. You know, like I'm surrounded by a bunch of undergrads from Maryland and New York, so I was thrown out into the rough streets of Miami, and I went into work with a company around here that's everywhere, and they're famous for helping a lot of people at once, which isn't good. They're not helping people because it was like 4 to 5 patients at a time. So when you're treating that many patients at the same time, because at first I was excited, right? The hourly rate was good because they're loading you up with patients.
Right.
I was excited to make some money. Had a lot of debt I wanted to pay off. So I started working there, and I was like the evaluation guy because I'm new. So I would only do the evaluation part, the time when you come in and you look at someone, you determine what they have going on. So I would do that, and then they gave me half an hour for that, which I was like, that's kind of short. Whatever, I'll just do that. And then I would do another one, the other half hour. So I would be doing 2 evaluations an hour, and I would do that basically for 8 hours straight. So 16 evaluations straight. Now, if you've been to like PT before, you know that's insane. Like the amount of energy it takes to focus on someone and evaluate their body structures and their systems and see how they move and give them treatment and then like maybe a home exercise program. That stuff does not happen in 30 minutes. So I'm already realizing that the quality of care is not what I learned in school. It's not the magical one-on-one, I get to examine you and work with you personally the whole time. It was not like that. So I was like, oh, it's kind of lame. And then I did that for day after day after day after day, and I got burnt out. And I was just like, this sucks. PT sucks, you know? And it kind of made me depressed. So I thought to myself, like, how can I do this the way I want to do it, you know? So in that time, I opened up my own LLC, you know, my little baby business. And I was looking for places that would allow me to treat inside of them. So like I was like, oh, some gyms would probably let me do it. So I went from gym to gym, and I eventually went to Elevation Fitness, where it is now. And I went to the front desk and I talked to, I ended up running into Angel, and he's cool. He's like, yeah, let's do it. And he gave me a little bit of a deal. Like I treat a patient, I pay for the patient I'm treating. And he saw the value because it's nice to have a PT in your gym and to be able to actually help someone and had to be able to say like, hey, we have a therapist here that can treat you. If you get injured, we have someone on site. So he saw the value in that, and I was really excited about it. And I set up my little table, and now I had my side gig here with like less than 10 patients a week, a lot of free appointments to get people happy because that's what you got to do sometimes. And then I had my more like full-time, part-time job, which pays the bills. And that was like the $45 an hour thing at the other physical therapy place that I'm not saying the name of. I'm being nice because it wasn't good. And they still exist. And I swear to God, it's the worst clinic in America. There was one clinic in particular I worked at with them because I would go around to all the different locations. And it was the worst. It felt like a third world country. I was like, how is this PT? So that actually was good because it motivated me to do what I do now. So if I want to help more people more effectively, it's not about treating like 5 patients an hour, because that's also what I did when I wasn't just doing evaluations. I learned that I had to actually like create like the most bang for the buck. Like, okay, so if we treat 1 person an hour, but I send someone to them, they can treat them from their home. That's what's the best. So that was my other little gig I started doing, treating people from their home, becoming in network with Medicare so I could help older people. And that's good because you're in network. You can basically work with people you could work with people using their insurance so they don't pay anything. So that was like another way to get in the door, and people would still come to me. So I would drive all over Miami, treating people from their home. I would work in Elevation for cash or for free. And I just started building up like a reputation that way. And, the rest was history, kind of grew.
So it sounds like you have, obviously, with your own business, you got to wear a lot of hats, you got to do a lot of things, and you got to work hard. Is this something that you innately had, or you got it maybe like from where
That's a
did
good
that come
question.
from?
That's a good question. Yeah, it's crazy. I think growing up, that's a really good question because I was thinking about this the other day. I think growing up, I have an innate like laziness to me. I think that's just ingrained in me. I don't know why, but it's there a little bit. I think when I played football, it really helped me develop my accountability and taking ownership and leadership of things. So I thank God I played football, even though obviously there's negatives to it. But we'll see if the brain damage sets in at any point. But like in general, I think that really gave me like some leadership aspects that I was able to carry with me. And I hate working for people to the extent that I was as a PT. Like the demands and like I had to hit numbers, I had to bill certain ways. I was just like, oh my God.
Right.
So I was like, I don't want to do that. So I was like, I want to do something more. Like I think it's a combination of me wanting to run things the way I want to run them and use creativity, kind of like you're doing with your brand and like creating like the whole vibe of it. I want to get to that point. I'm starting to get there. And to manage a business and be a good boss to a lot of people as opposed to taking orders from someone and having to fix myself into what they want. Because when people do PT, they think PT is awesome because, oh, I get to do whatever I want. I get to treat people however. I'm a doctor. But it's like when it comes down to it, you're still a cog in the wheel, especially at the places I was working. It feels good to exert that control and to not be bogged down by just feeling like someone's like here and they're going to like meet with me and maybe complain about my billing or something dumb or, it just takes one comment from a boss like that. And I would be like, oh, like, I just want to do this my way.
Right.
I'm sure you had similar experiences, but like
Absolutely.
whenever you work for someone, it's like, you can't shake it. Even if it's the coolest boss, you're still just like, ugh, I want to do it my way. And I want to like create a whole culture, a whole company that can help people the way that I would want to be treated as a worker, even though obviously I'm not, like I said, I don't really like it, but like I want to be such a cool boss to these people in the future that they're like, damn, this guy's cool. And the whole model is nice,
Yeah, I mean, it makes sense. Let me ask you, if you didn't have that 30-minute per patient quota system, if you didn't have that experience, do you think that you would have your own practice right now?
Yeah, right. I think it was helpful to get screwed a little bit like that. I think I was like, damn, like sometimes bad stuff like that makes you like, freaking line up and nut up a little bit. I was like, okay, I can't. This is terrible.
Right.
And thankfully, well, not thankfully, but in terms of my business creation, thankfully, a lot of businesses are like that because I ended up working at a better clinic that was like 1.5 patients per hour. Or at least when I was treating, it was 2. When I was doing evaluations, I got a full hour. But it was just like everyone just seemed, it's a high burnout career because of those demands like that. So I was like, damn, that motivated me for sure. So yeah, I think it did help. I think it did motivate me to start my own thing and to create something that hopefully is a model that's used more in the future and changes the industry a little bit.
What's your model?
Well, there's the 2 aspects to my business. The one that I do inside of Elevation Fitness, the one that is Physiologics, the way that it's presented in Miami, outpatient physical therapy is basically treating one-on-one for an hour, but it's highly focused on like patient satisfaction. So, because that's just me in general, I'm a little bit of a people pleaser. So I want to make sure everyone's happy with what I'm providing them. So like when I'm treating people, like it's always going to be one-on-one. And sometimes they're the only person in the room. I don't even like the concept of sometimes in PT clinics, it's like it's a crowd, even though I like the yapping and all that. It is nice to just people get their own individualized attention and for them to be satisfied enough to want to pay that money for those appointments if they don't have insurance coverage. So it does reduce the profit margin at these other places that are doing it, like compared to these other places that I've worked. But I think that model will make people realize that what they could get out of physical therapy. Because if I went the other direction and just tried to load it up and did like that strategy, it would just continue the culture of what PT looks like to most people, which is like 4 patients an hour, super shitty service. And they're just like, yeah, it kind of worked. I got to talk to people that want to. I treated a girl today. She came in, she messaged me a few months ago about needing PT. And she's like kind of my friend. So I wanted her to come in. I was like, just come in, you know. I was going to like hook it up, make it like cheaper because I knew it was expensive. And she ended up going to the place that I used to work. And I reached out to her again like 2 months later. And she's like, I've done like a couple exercises there. It's just not really good. And I'm like, I knew it would be like that. Like, come in. So she came in and she tried it. It was like a free appointment. And then she ended up buying a package when she spent more money. But it was still affordable. And she's getting the one-on-one care. And she's seen so much progress in 2 appointments, more so than she got in a couple months at the other place. So like it can, if there's enough clinics like that, because they're big in Miami, they're big. People are doing that a lot now. The cash pay or like the insurance, like out of network base, which I do out of network. I try to get people coverage no matter what.
Out of network just means that if you don't have Medicaid or insurance, you can still take care of them.
Yeah, like out of network is like if you have an insurance plan, like let's say you have Florida Blue. I don't take the insurance in network. It's not like you could just give me your card and I'm like, okay, $5 an appointment. There's a separate set of benefits for providers like me that's out of network. So they still can provide you with benefits. They're just not the same. They're not like as good as in network.
Right.
But if we're talking, you pay $5 an appointment, but you're 1 on 5, you might pay more money initially to hit your deductible, which is when you start getting coverage. But like once you start getting coverage, like you're getting a discount. Like some people, my patient today pays $20 an appointment, and she gets like a one-on-one massage the whole time, and her insurance pays me well, almost better than cash sometimes. So, and her co-insurance, it all works out. It's a win-win for everyone, and so there is benefits to that. I mean, I'm forgetting the original question now.
No, so the motto of Physiologics,
Yeah,
right? That's
bro,
how you say it.
say
I'm
it
saying it right.
See, if you say it right, then people will know it's possible.
Absolutely, because you gotta hit it with the Z, is what I was telling you before. Physiologics. What does the name mean?
So when I was trying to think of names when I started, and I'm super indecisive about it. And then I was like, wait, like PT is also called physio. Like in other countries, they just call it physio.
Mm-hmm.
So, and it's a physiological endeavor. I'm not just rehabbing people, like, and rehab does include physiological concepts, but I'm also taking them to that next level, right? So I wanted something that sounded kind of sporty, that incorporated the name physio, which is kind of the clever part, right? And when you combine the word physio and logics, it kind of sounds like we were talking about earlier. I did kind of think of the fact that it sounds like it's logical to take care of yourself like that. When the X gives you that little cool factor, not that it's actually that cool, but like,
it is cool, especially after Elon Musk turned Twitter into X.
Yeah, right.
There's like a cool edge to it. Yeah,
I think that he thought of that idea because of Physiologics.
Maybe that's what it is. Yeah,
He was like, oh damn.
Yeah.
Wait a minute. No, but I think there's a clinic, there's a PT brand that was opened. It's called Physical, but it's Phyzical. And it's kind of like a millennial brand. It was like created just for like the most, it's like these Instagram companies are created to be the most like catchy and like easy to remember. You know, like this is a company like that, and they do balance because they know people need balance and no one focuses on it. I'm doing a free plug for them. But like the letters Y, X, and Z, they try to include all that in the name because they know that, well, I guess there's not an X in it, but regardless, that combination of letters they determined was like the most effective way. It's like the shortest, coolest name that still describes their business. Mm. So, you know, an X is one of those letters. So I was like, instead of just Physiologics CS, with an X, it kind of like ends it early and it has that like sharp letter.
Yeah.
So I was thinking it's kind of changes it up a little bit, but it's kind of a mouthful, just like my name, Robert Polizuk. It's like everything is hard to remember. So when I'm calling offices or when we're getting plans of care signed, I'm just like, remember me? I'm the one with the confusing names. But like, it's kind of, they laugh about it.
It works out.
Yeah, it works out.
No, it works out. So like, are you doing also preventive maintenance? Are you doing, if somebody has an issue with their body, they're coming to you, like what type of things are you seeing?
Yeah. So yeah, there's different aspects to it. There's the preventative stuff. That's like they call that prehab a lot of the times. So, and that's really fun because I can just use my own brain all the way. They don't come in with a prescription saying like I need this thing fixed. I can look at it like on the whole, like what's going on with them. And if they're willing to do it like that, I can give them like a comprehensive routine of exercise and prehab exercises and flexibility, and I can do things like cupping and dry needling, and all this stuff can be used at my own whim, and they're not expecting me to treat one particular thing, and I can do that and create their mechanics from the ground up so they don't get hurt. So like I have a baseball player right now who has an issue with like hip and knee and shoulder issues. So yeah, we're looking at his mechanics. We're going through the pitching motion and having him just do part practice in different spots where basically I'm working like on his windup or like stopping, holding it there and then returning slowly and just trying to master those motions like Tai Chi style almost.
Mm-hmm.
So then from there he can take those mechanics into the full pitch. Football players, I had a football player that he recovered from his ACL tear, but I kept treating him for his mechanics. So the way his knees move and hips work and the way his core interacts with his hip and his knee. So when he's cutting and planting his leg, he doesn't cave it in, right? So all these things are factors that could lead to injury. So athletes like it a lot, but sometimes you just do it for normal people that like are kind of lazy with homework. So they just come in once a week and I treat them forever. And those people are usually paying with cash. But it's really important. And I think it should be like mandated. Like if they're going to do all these laws for like insurance, they might as well have like a yearly checkup that the insurance pays for. Whether that's because the government said it or because the insurance company wants to be attractive to the patient, they should give them a deal where you can get like a movement analysis every once or 4 times a year. But that'd be a great selling point for me too.
Yeah.
But it would be good for people.
So my daughter, she's in college and she went for in the beginning she went for kinesiology.
Yeah.
Is that because from my understanding is that's just understanding the movement of the body and the body mechanics, things like that. Is that something that's kind of linked to what you're doing?
For sure,
What
yeah.
is how does that play a part into that?
Well, my major that I told you about earlier, exercise science, is just like another name for kinesiology, basically. Like they changed the name of the major at my undergrad, which was SUNY Cortland. They changed it from kinesiology to exercise science. I think that was just to make it more like traditionally named. But yeah, kinesiology is the study of the way that the body moves. So with that major, when she completes it, she is still in it.
So she was doing kinesiology, but now she's doing I think it's science. What is she doing? She's doing like
Is it related to it?
no, health sciences is what she's going
Okay.
into. She started with kinesiology, doing a minor in business. Now she's doing health sciences with a minor in business.
She wants to be like you. Business, of course, yeah. She sees you. She's like, I want to have a business.
We tell our kids like, you got to be better than me, not just like
Yeah, right. That's the best
100%.
way. I wish my parents did that. But it all worked out, you know.
Yeah, so health sciences is really what she's.
Yeah, that's good because she'll probably have all the prerequisites she needs when she graduates to maybe go into PT school. So, and she could probably still offshoot into like PA school. And maybe with another little semester, she could become a physician. If she want to go like get her little, advanced bio and all the other stuff she might need, organic chemistry, you could get all that in, and then you could shoot off into a bunch of careers. But yeah, kinesiology on its own would be like, if you just graduated with that and stayed with it, you could probably do like research based in the science of exercise. Obviously, I mean, it's not like a personal training degree, but like it would make you like pretty good at that. But yeah, a lot of it's like research based. I mean, like I was telling you earlier, when I graduated, I was like, damn, like I want to know more about how to help people get better. And I want to have that influence on people. Like they respect me when they come in to heal them and make them better. So when I graduated, I was like, oh, hell yeah. Like I took a year off and I was like, nah, I want to be like the expert in this. Maybe it's my ego. But I was like, I could have been like a trainer with like a movement specialty, because a lot of trainers don't do that, right? They just become a trainer and they get like a bunch of things. They get the cup and they stretch and then they do scraping, and then they can kind of piecemeal together like a little faux degree in rehab, which isn't I used to hate on it, but I'm like, damn, that's not a bad idea if you want to save money and get right into it. You can save yourself 3 years of college more, and you can make money that whole time and build a name for yourself. But now I have like an actual license to treat people rehabilitatively. And I can scale my business like that because like I'm a DPT and I can have PTAs work for me and like I can create a structure.
DPT is what?
A doctor of physical therapy. Yes, that's what I graduated from University of Miami in 2017. That's the degree I got. So that's a DPT, and that's an extra 3 years on top of undergrad. So when she graduates, if she wants to go into PT school, it'd be like 3 more years, and maybe 3.5 if she wants to do some special stuff. But like my friend got I forgot the name of it, but he got a specialty. He got a orthopedic clinical specialty, and he took an extra like year at USC from UM. He's like a brilliant guy, and he got his OCS on top of his DPT. So in the future, that might be what you have to do. They always like to make it more specialized, always more advancement in training, so you could be the best version of a PT possible. But
And for us mere mortals, OCS means what?
oh, sorry, yeah, gosh,
Yeah.
and OCS.
I like the talk. I love the talk, but I gotta follow.
It's an OCS stands for a orthopedic clinical specialty. I almost forgot. There's a 2% chance that's wrong. It has to be orthopedic clinical specialty. And then there's an SCS, which is a sports clinical specialty. And this is like an intensive extra 1 year. Honestly, it's like a huge upgrade to your PT degree. Like I could have done it, but I wanted to get into helping people.
Yeah.
And honestly, it's like people are like 99% happy with PT, and you get the OCS, and it's like you know so much more. But to the normal mortals, they're just like, wow, you're so good at treating me. And I'm like, yeah.
But you get that extra 1% of knowledge. I mean, that if you're in that extra 1% who knows his shit,
oh my god,
that makes a huge difference, man.
The way that he breaks things down is like I'm at the point now where I'm like, I want to hire people like that.
Yeah.
You know, but he has his own business ideas.
But you have basically a practice now, but it's a very innovative practice because you have a lot of. Not only are you doing also part of the training yourself and the therapy yourself, you also have other branches that you're diversifying. So you're kind of like almost like you're very niche in what you're doing. Very niche, you know. And remember, I was saying like what got you to work hard? Because I know you said you have a little lazy side to you, but from the sounds of it, it sounds like you're a workaholic, man.
I'm self-deprecating a little bit.
Yeah.
What got me to work hard? It was the pursuit to be fully lazy. When I was joking, I think what got me working hard, was me being like, "Is this it?" I remember one day in particular that I when I was working, and it was like 2017 or 2018 when I'm still living in the same apartment because it's a good apartment. I should have just considered buying the apartment when I got it because I've been there for 7 years. What a sucker, right? Paying rent for 7 years at the same place. I almost want to move in spite of them. But I was at a bar and I was like calculating my loan debt and how much money I was making, and I was like, this is horrific. Like I could plan out like the rest of my life and like know exactly where I'd end up just based on those numbers. I was like, this is so sad. I make $75K a year. I'm $150K in debt. And like, even if I lived like super meager, then I would have to, I don't know the right word. I would have to like pay that off so slowly and I'm never going to catch up. I'm like, this is pathetic. I'm like, oh, I got to do something more. But that was like the money making aspect. I always wanted to help a lot of people. Mm-hmm. But when you start PT, you want to help people. Like my motivation to run the business was like, I want to help people on a grander scale. You know, I want to because I could always help people at an office, right? I could be there and treating a couple people an hour and giggling and making jokes and it's fun. But I'm like, I want to create a whole system where I'm helping a ton of people. So it isn't just about the money. It's more about like scaling the amount of people I could help. And then it could, if enough, a lot of PTs are doing stuff like this. And if enough of it's like that, people start viewing physical therapy in general differently instead of just like one of those places I was working at before. Right. So you can view it more like, oh yeah, PT is good. I've been to PT. And then more people, it'll be like a disease. People talk about how it's a good thing instead of like, oh, I've been to PT, it just doesn't work. Like people already I got to get over those preconceived notions. So the whole niche thing you were talking about, like, and me being super oriented on customer service and making people very happy and get better quickly, like that's the beautiful part about it because I can push my attention onto that instead of pushing my attention onto how the hell am I going to do 4 things at once and just get the notes done. Because PT will still kind of work with that many people, But if you're like doing this, it'll go way slower. People will be disappointed, but you'll get like an 80% hit rate. But like with the way I'm doing it now, it's like 120% because people are like, whoa, this is way better than I could have imagined. And any PT on their own will have that kind of experience. Honestly, any like a regular PT just doing one-on-one is better than me with two patients because they're like focused and they're just relaxed. So to me, that's the goal. So I guess the answer to your question is it's not just me being lazy, it's me trying to help as many people as possible in the most effective way without sacrificing quality.
Right. And then by default, that also brings you, financial gain
Yeah,
and
yeah.
I think everything comes. It's like if you're doing not necessarily you're on your mission, you're helping the most people, and the more people you help, the more you gain from it. So it's a
Yeah.
win-win-win. Yeah.
Yeah, I get to do what I like. I mean, that realization I had when I was at that bar and for some reason I thought about it, I did the math.
Hmm.
That was more of like a realization of like I should start a business. But like obviously I was a PT, so I was like, okay, I'll be PT. And I was like, ooh, that'll help me treat more people anyway, and I can do it the way I want. But I had to shift my mind. It took a while because I think that laziness was like hanging on for a little bit, you
Hmm.
know?
Hmm.
Like when I started, I was kind of like half-assing it. I'm sure there's things I'm doing now that in 10 years I'll be like, God, I was still being lazy now. You know?
Retrospect, yeah. Hindsight is 2020 always, man.
Yeah.
So, but so you got to that point, and now, like at this point, where do you see yourself in a year from now?
Oof, that's a good one. I probably so when elevation moves, there's a chance that I could be working. We got to figure things out, but I'm in
With the
Midtown, like
Midtown, yeah,
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 like
yeah.
in that facility
Hmm.
potentially. Hopefully that works out, and so that's the location in Midtown. But it depends. I mean, we gotta look at rent and everything. Rent's crazy out here. I have the location in Miami Shores. But I'm trying to expand out some of the collegiate stuff I do. I work with athletes at a college, and I handle all the billing and everything. But they like it because they can offer a physical therapist for their athletes. So I was trying to actually scale that to other colleges too, but it's not so easy. I think the part of my business I'm trying to grow the most is the one that we touched on earlier, and that one has the most potential for like logarithmic gain, which is, in my opinion, because I've been honing it for a while, is treating patients from their home, but not me doing it. Like I capture the patient, we try to use the patient's insurance, and I connect them with a therapist, and I can do this all like almost totally disconnected at this point because I've created systems with my personal assistants that they get the ad comes to them, they call, they reach out to the therapist and they connect them with the patient, and it's all just
So
it
now,
feels like a different type of it's like not even it's PT and it's one-on-one and we're at their house, which
yeah.
is really attractive to these people because they just respond to the ad and they're like, wow, that's cool. And so it's still good quality, but I'm running it like in a way that's more like I'm operationally running it, and it feels
Yeah.
kind of I like that.
Yeah, yeah. It's almost that would be probably like a sister company to Physiologics, Physiologics at some
Yeah.
point,
Ooh.
because they can't get Dr. Rob. They got to get an ex
Yeah, yeah.
player, another person who's doing some obviously a similar but not maybe the same level type of treatment. So at some level, does that make you think, damn, I'm kind of like doing the same thing that I was working on prior, or you have hands on the quality that they're getting
Yeah,
as far
oh
as the
yeah, that's the
treatment?
cool part. Because this whole thing was started for me wanting to provide quality one-on-one care with patients. I was like, we're not going to make PT horrible where everyone just experiences bad stuff.
Hmm.
So when I did the in-home thing, I made sure sometimes there's a little bit of a sketchy part. Sometimes you hire a therapist, right? These people are being treated in North Florida. Like this is becoming like, it's not like huge yet, but like sometimes you get random leads because someone saw the ad and sent it to their friend, and I'll get like a lead that's in like Tallahassee. So now I got to hire a Tallahassee therapist. So then I connect them to the patient. I look at their resume. I call them. I mean, this person seems cool, and I go over the groundwork. And this is the part of my process I could make even better, which is like explaining to them the culture of the company, which is something I've just been able to settle into teaching people because now I got the other process down
Hmm.
of like the
Hmm.
technicalities. So now when I'm hiring them, I'm like, I'll be like, okay, like, like we treat one-on-one for like an hour plus sometimes. So you have to be able to provide quality care. You can't be on your cell phone. You can't be treating people like these in-home if you imagine, like, some people get their grandma treated and it's like home health, Medicare Part A, which is home health. That's like when you see your grandma when she's really old and she's like barely able to move and she has diapers on. There's like a nurse there, like, come on, we have to drink. You know, when they have those people provided to them, that's a whole nother part of treatment. That's like they pay these people like a few $1,000s, the company, and then the company hires people to take care of them as long as they're willing to take care of them before the money dries up. And it's the quality of care is not there. Like PTs will come in for like 30 minutes sometimes.
Mm-hmm.
I don't want to talk too much trash, but we're on the other side of it, Medicare Part B, which is like outpatient services. So it's like when your grandma was younger and then she wanted to just go work on her knee pain and she went to a clinic and she's like an enthusiastic, relatively healthy 75-year-old woman. Like we're just doing that, but we're going to their house. So like when you think of it that way, I have to explain to these people I hire, like, you better be good at that. Like, and then I have my assistant, she'll call the patient like every 2 weeks and she'll discuss how has your treatment been going, how long they've been coming in, do you like the therapist? And so we collect info on the therapist and how they're treating. And then think about it, like if you're getting treated from your home and then like imagine you're like the son of this grandma and you come home and she's on the phone with the clinic talking and they're discussing with her how her satisfaction with the treatment. Like I feel like I'd feel good about that place treating her.
Absolutely.
Because I don't think it's such a simple freaking thing. Like, and these assistants, I don't. It's so they have time for it, and it's part of our process. So then, and if it's not good, she'll tell me, and then I'll talk to the therapist, or we'll switch them out, and then eventually, just all the cream rises to the top. You get like the best therapist treating the patients, and it's kind of cool. It's cool making systems. You probably know how this is because you've operationalized a lot of things. It's cool creating operations and systems that like are self-managing and like it still maintains customer satisfaction. So
Yeah, and it's funny because even we were just talking about not wanting to work for somebody else and creating your own thing, and at the you realize that as a cog in the wheel, you're like, okay, I have a boss, and you're like, what it is. I mean, it's for me, it's been like probably 20 plus
I
years
was gonna
since I've been in
say,
that situation. But I do remember. However, I remember and I know that I've traded that one boss now for everybody who walks through the door is my boss. You know what I'm
yeah,
saying? There's a
yeah,
there's a realization of that. And then I think it's okay to accept the fact that you're offering service and you're doing it for somebody else. So then at that point, you're like, oh, fuck it. I'm really here to help the person. So that kind of stuff washes away. You know what I'm
yeah,
saying?
right.
Yeah. Yeah.
That is a good point. The thing that you just said is, I always tell people like, oh, you don't have a boss, that must be great. And I'm like, well, now every patient is my boss.
Yes.
But it's like the way that you're right. The way that I made it into an operation now, like I don't even like a patient could be dissatisfied and then the therapist can be talked to and replaced without me even like having to like expend my empathy resources on it.
Yeah. Yeah. Yeah.
Which
Yeah.
sounds I don't mean that like in a bad way, but because like they're happy and I don't have to be like if I have a patient that's unhappy, like when I had that worker a few months ago that you were kind of referencing that you said there was another worker in my clinic. And like he was awesome. He actually never had an issue, so it's not a good example. But like some patients, like I just on the way in, I was on the phone with a patient who's getting treated from a therapist, and she likes to call, and she's had like 3 or 4 therapists because she's got standards, and sometimes she likes them, and sometimes they had to leave. But I'm always like navigating it and making her feel happy. And sometimes it feels good, but like doing that a lot, if it was all me treating someone and I had to deal with each patient unhappy, and I'm like, it takes a lot out of you. But now I can step back from it and then have the whole concept of the satisfaction taken care of without feeling like each patient's my boss.
Yeah.
Because if I'm treating 50 or 100 appointments a week passively, like in this home stuff,
Mm-hmm.
and if I had to deal with every single like minor complaint, which there's not a lot because I think they understand what they have to do, that would be exhausting. Imagine if every single person giving me tattoos, every little minor thing, like you'd have to like personally deal with. You might actually do that, but
Well, I did that for a while while I was doing the company, and I had 3 locations, 30 artists working under me, and trying to do my own personal tattoos, taking care of clients, and still sometimes stopping a
yeah,
tattoo and hearing about complaints. Yeah, this person did this, and the person complaining doesn't give a shit what you're
no,
doing. You know what I'm saying? So one of the things I learned is just to like pivot really fast and also allow the bullshit to just pass by instead of like being a resistance capture fucking person. I'm just like allowing it to flow through, and I'm like, okay, where's the solution? Quick fix, here you go. Here's this is what you need to do. Get it done. Cool, no problem. Let me go back to tattooing. It's I did that so many times that eventually I kind of like got a almost like a mental callus of
Yeah.
that. And it's very easy to navigate now. You know what I'm saying? Because it's I know things will be okay. I'm confident in what I do. And there's a product called Empire Inc. that shows, what the outcome of that. So it works well, and then you could pivot that into other things that you do because everything's gonna be all right as long as you stay consistent, you do the right thing,
Yeah.
and you work hard and you try to work efficient and smart. So I think it's just a formula, man.
Yeah, I mean, it allows you to help more people because you're not letting yourself get caught up in each individual person's bullshit.
Yeah, yeah.
I mean, it's not bullshit, but you know what I mean.
No, but
The
there's a lot of
bullshit
bullshit
associated with the situation.
Yeah,
Yeah.
there's,
Unfortunately.
there's a lot of bullshit. So let me ask you, the cupping, right?
Yeah.
Cupping therapy treatment. Do you use the cupping is something that I actually learned not that long ago. I
Yeah.
started watching. I think it became like prevalent for a while. I don't know. I was watching on social media and I started seeing everybody
Yeah, it
cupping.
pops up sometimes. Every like few years.
And I'm like, oh, well, this doesn't look like a normal regular practice. So you guys use a lot of holistic practice on your side, or
Yeah.
what? How does that work?
Yeah, if you're referring to holistic as like different physical modalities, then yeah. Like we don't do like any. Sometimes when you hear holistic, it brings to mind like other things that I don't do, like crystals or chakras.
Yeah.
Or like I do dry needling, which is like the Western version of acupuncture.
Right.
So it's like everything that I do is very like based in Western medicine, and yeah, I mean, it's all based in like Western research medicine. Not that it's like way bad. I'm not saying it's like that's the way, but I'm like I just want to keep it that way because that's like the things that are being researched and developed. And cupping is a great modality for a lot of people because you're creating like a negative pressure. You're pulling up on the skin. And so we have the muscle layer, we have the fascia that runs on top of and through the muscle. And then that kind of connects into the skin. It's like when you're eating like chicken breast and you can like pull that shit off, that freaking like thin white stuff, and it just like snaps back. That's how fascia kind of is. Now imagine if there was skin on top of that. I mean, I'm sure like turkey. Like when you're like pulling the skin apart, you can see all that stuff in between. So that is the substances that we're usually working with PT, right? We're trying to work on the active muscle tissue, fascia, and the way that the skin is our conduit into it is how we treat things. So by putting a cup on it and then sucking that air out, it brings the skin up, right? And you see all the reddening of the skin. That is the little blood vessels popping underneath that layer, right? So people, they get obsessed with seeing the red spots. That's not necessarily what you need to have, but like you'll see areas that sometimes are more in pain. They'll be more red because there's a lot more concern for the blood flow to go there when you're pulling up on that skin. But it's not always like that. Sometimes areas that are you pull up on the skin, you suck it and you take it off and it's like it almost goes away immediately. They'll make a little mound because there's some fluids in there when you pull up on the skin that are not like lymphatic fluid or anything that isn't just blood flow in the area, right? So that's why it kind of stays big for a while. Regardless, you're just creating a negative pressure instead of a positive one. So it's the same effect as massage. So, well, it's not the same, but it's similar. With massage, you're using positive pressure because you're pushing down on the skin. And by holding it there for a while, eventually the muscle kind of gives in. It relaxes. It melts under your finger. And that's because you're creating a hypoxic or no oxygen area by pushing down on it because you're like cutting off circulation almost to that area, then it can relax. So if you have like a knot or an area of high like activity where the muscle's just constantly contracted, there's something happening in that area, whether it's just protecting. Like there's a high tone area, whether it's trying to hold something in a position or keep something from being damaged because it's being on high alert, whether it's from past experiences or from an actual physical issue. Like let's say in their trap, that's where usually people feel it. By pushing down on it or pulling up on it and just leaving it there, it creates that environment and eventually it can release a little bit. And cupping allows us to create little nodes along the line that you're putting the cups on that you can stretch from. So sometimes I'll cup people. Let's say you have a stiff lower back. I'll cup their erector spinae right on either side of their spine. And then I'll get a little bit to their QL area on either side. And then I'll have them like reach through and do like quadruped reach throughs. Or I'll have them like even like deadlift or do Jefferson curls where you like roll down and you roll up like a snake. So they're kind of just stretching the whole fascial system all the way from their neck down to their feet. So then you can just move differently while you're holding down a spot. Then when you let it go and you take it out, now it's like you've gained all this slack in the system. And it's not like you're actually breaking stuff down. Sometimes your body just alters its tone. So now it can just relax a little bit and you can get more motion out of it. Because that's like a subconscious thing happening behind the scenes. It's not even subconscious. It's just like it's like a super spine. It's like your body is sending messages to protect or stay tight. And when you can do something for long enough that feels really tight and then relax it, they'll just gain range of motion. And they can learn to move in those ranges of motion healthily and not painfully. And then eventually they can conquer those things and move better in general. So cupping is not like the end all be all, but it's a great way to like basically have a bunch of thumbs in someone as they're moving. And then when you take away that stimulus, now they feel like they can move more. And then there's the cool part with the red spots, and then you can walk around like that.
Very interesting. Yeah. You're like, hey, he did some cupping, and then the dry needling is well, how does that help? Is that doesn't the nerves, they hit the nerves?
Kind of, yeah. I mean, so dry needling is everything that I do, like with cupping or needling or soft tissue, there's two major systems we look at. We look at the neurophysiological effects, which is like how your brain and your CNS interprets what it's feeling and how it feels afterwards. And then it's the physiological one, which is just like the actual damage or micro damage caused by the needle or the cup or the thumb or the elbow going in the tissue itself. So with needling, and this is always something that I have trouble explaining perfectly because you don't want to like shoot over someone's head on it, but you also don't want to like describe it like too simple because you're putting needles in someone. Mm-hmm. And you know.
I know all about that.
You don't want to just be like, I'm going to put the needle on you and you're going to have marks later and it's going to be permanent. You want to be like, if someone's like really like, people get nerdy about what's going on. You want to be able to explain. So sometimes I just go there. But so there's a neurophysiological effect, which is basically altering your brain's pain perception of that area. So for example, when a needle goes into a tissue, the tissue responds to the pressure and the damage caused by the needle, and it goes into like a reparative state. And it's not just the physiological phenomenon like substance P and cytokines and other things that your body, like biomarkers that your body will send to the area, which leads to healing. I mean, that's like a general concept just for things, processes happening to make it feel better physiologically. But it also hits on like sensory nerves or sensory receptors, right? So there's different like sensory receptors for pressure, for pain, for heat. And when you poke needles through stuff, it's your brain's gonna be like, what the fuck? And it's gonna feel it, and it kind of like relaxes or changes its perception afterwards. So in your brain, you have an image of your body, and they call it the homunculus. It's like this weird looking guy. He looks like Gollum. Mm-hmm. And it's what your body feels. So like everything on the head is big because everything's super sensitive here. The feet are big because your feet are sensitive. Your hands are big. If they had your genitals, it'd be massive because, that's how that works. Yeah. Everything that's like sensitized or can feel something is very big. So it's how your brain feels things. And like the body's tiny because like this is all just like this. It's not like super sensitive compared to like your tongue and your lips and stuff. So when you're in chronic pain or you have something like a trap issue or lower back issue, that homunculus will either subtract or increase that area. It'll be like, it'll grow it to be really concerned about what's going on, or it'll shrink it to make it like not an issue anymore. So your little homunculus guy will have like, in the trap area will be huge because it's like such a focus of pain, or it'll shrink down and it just becomes like it doesn't work the way it should, right? So with needling, we're trying to like kind of expose that system and change that, at least from the neurophysiological perspective, right? With needling, with cupping, with the thumb in it, all that stuff, physical modalities that we're just putting in you or on you to change. So you can alter the way that you feel afterwards with needling, especially by putting the needle in there, and then your brain gets that reception. It's like, okay, that hurts. So like when this is done, I'm going to I'm going to change the way that feels in general afterwards. So you can almost reset your CNS a little bit with needling like that. That's one component of it. It's nociceptive, which means it's painful. And there's also another term for it. It's called diffuse noxious inhibitory control, I think, and it's DNIC. And basically, by doing something painful, it feels better afterwards. That's the most simple form of it. But it also, there's something called the pain gate theory, where like when something hurts, you can, when you're poking a needle through something or making it hurt, it's tough for your body to feel two types of pain at the same time. So you can change that. You can change the way that your brain receives information from that region, and it can actually reduce pain too. So there's a bunch of neurophysiological phenomena going on that can make that feel better. But the real thing is like for example, like a tendinopathy or a muscle bundle that's just contracted. By putting a needle in it, it's the same kind of effect we were talking about earlier, where you can have these substances released into there. Your body has like a reparative state happen, and it kind of resets things. Or for a tendon, sorry, I keep going. This is interesting though. I'm on a roll. If it's like a tendinopathy, like I have people with like subscapularis tendinopathy, which is when you have pain in the back of your scapula here.
Yeah.
A lot of people have that.
We actually I do.
I knew you would, because you're like a gym bro. And every time I put my thumb in it, everyone's like, oh.
Yeah.
And I'm like, and I put needles in it, and I can like really go just poke until I feel the back of the scapula, which is the origin of your infraspinatus.
Yeah.
And you put all over there. You put like 10 needles. Well, that's a lot, but you put like 6 to 10 needles, and you twist them up, and you get all that fibrous fascia and muscle, and the part that comes from the bone, because it really comes from the back of your scapula. The muscle comes off.
As you're saying it, I'm feeling it.
I know, now you see, you're thinking about it.
Yeah.
I'm selling you.
Yeah.
It hurts, doesn't it? Maybe you need help. And you're twisting it all up, and it's like pasta. You twist all that muscle tissue up,
right?
And then you can even put electricity on it where it thumps. You've probably seen when people do that.
I've seen those, yeah.
And think about like what's going on. You're twisting, like in that localized area, you're doing it 10 times. It's repairing the origin of that muscle. Or you get down the tendon of it. When you have tendons that are chronically injured, like a tendinosis or a tendinopathy that's been around for a while, which kind of like a tendinosis, they call it. The tendon that connects into the part where it needs to just gets kind of, instead of like straight lines with all of its fibers, it gets a little bit scraggly because it was inflamed and then it healed like this. And it used to be here, but it got inflamed, it heals like this, and it's all weird. So you put the needle there, you twist that up, and we have the pain gating thing we talked about earlier, the neurophysiological thing, but we also have the physiological aspect of creating that damage that when it heals, and they've shown this with studies using ultrasound, that it can heal a little bit straighter. And you do it multiple sessions.
It releases the
It heals over and over, and it goes from here to here to here to here.
Is that what causes like
Graston's like that too.
That's what would cause like a pinched nerve at some level, or no? That has nothing to do with.
No, I mean you can get nerves bundled up across muscle fascia along the way. A good example might be thoracic outlet syndrome. There's 3 areas that could hit. It could be it's the nerves that come from your neck, and it has to go underneath. It has to go through your scalenes, these muscles that are here. Then it has to go under your clavicle and on top of your first rib. So it's another pinchy spot. Then it has to go across your pec minor and pec. So it's like 3 areas where you can get kind of tight. That's the kind of stuff where you're like, it's if your hand gets tingly, like in your pinky and your so that, or even these 2 fingers. But sometimes when you see that, you want to like decrease tone in a muscle. You can put needles maybe in someone's pec, like at the lateral portion of it, to help release or relax it a little bit, so that nerve can glide more. Or you can do it if it's really something coming. When people talk pinched nerve, they're usually talking coming from your cervical or lumbar vertebrae. Like the nerve is exiting the spinal cord, and as it's exiting, it gets pinched. And then that little pinch, because of whether it's bony or like a ligamentous sprain that's created inflammation, that nerve can be like, and it makes tingling stuff happen. So when you feel a pinched nerve, like needling could be an option just to. You can put needles right across the nerve pathway. People have done that, and I've done that before, to like release or relax the tissue coming away from it, so that it doesn't feel as pinchy.
So if somebody comes in saying, like, for example, I want to have more mobility, let's say, because you're dealing with a lot of I think you're dealing with a lot of bodybuilders too, no?
Yeah, no, for sure.
So
Carlos.
when they ask, for example, mobility, what would be your recipe there at that point? What you know?
Yeah. Well, sometimes, yeah, people are looking for things that aren't exactly what they need. So if someone comes in asking for mobility, I'm still going to do an evaluation to see what they think their mobility issues are.
Mm-hmm.
And sometimes that means that they don't need mobility. They might need more stability. But sometimes it means they actually need mobility. And bodybuilders know their bodies pretty well, and they're usually pretty tight, as you can imagine.
Yeah.
So, like, when I work on them, yeah, like, I'll be doing shit that makes them look dumb, like yoga type stuff, and I'm pushing on them. Or I'm grabbing their legs or their arms or their neck, and I'm, like, mobilizing it using my hands. You can mobilize from this area, like right against the spine, or right against the shoulder by pushing down. So if you have shoulder pain, for example, and you're a bodybuilder, you're big, you can mobilize the shoulder downward within that socket, and it helps you lift your arm upwards because it's a ball and socket joint, and the socket is your shoulder blade right here, and the ball is your upper arm, the humerus. So when you lift up like this, you don't want it to hit.
Right.
Sometimes it's like that. When we get all big and strong and there's all that tightness going on, you lift up and it wants to go to this, and it feels pinchy. And then you got your acromion over here too, the part of your shoulder blade, so things can hit and get squished.
Yeah, it's almost like bone on bone, almost.
It feels, yeah. People will think
Feels
it's
like
bone
it?
on bone, but it's just
It's
like an
not.
impingement happening. So you gotta get their arm in that position and then push down and work on some of the tissues that could be having them do that. Usually rotator cuff strengthening. If I had to pick one thing to do in PT to make people feel better, like everyone talks about movability, stability, needling, cupping. If I had to pick one thing to focus on, like if I only had one tool in the toolbox, it would be just like treating people in a gym and using exercises, because that's the most effective, obviously.
Would it be now? From that perspective, would it be exercises done the right way? Because a lot of people are probably
Yeah,
doing them, for a long time the wrong way. So you eventually build bad habits that are strong, right?
yeah, no, exactly, bro.
So
That's it. It's like they do things wrong, but they get really good at it, and they have like they'll be arching their back a ton just to deadlift. So their body knows to create tension and strength by arching their back a ton. And when they're lifting like that, it feels like, okay, I can create tightness here. So when I teach them to tuck their pelvis a little bit and keep their self neutral and bear down with not bear down, but to create stability like between their ribs and their pelvis by locking this in a more neutral position, they feel weird about it. It's like now you got to like create tension along a new pathway that you just discovered. Like, because if you have like a girl who's always walking with her back arched and she's used to pulling and deadlifting like that, and then she has extension-based back pain, and all I could do was do exercise with her, I would teach her how to tuck their pelvis under, keep them more neutral, and then deadlift from that position, which probably means lowering the weight. Because imagine if you had to change your squat form and you were like squatting like 350, and I was like, okay, do 350 again, but we're gonna tuck our pelvis this time, and you're not gonna be as extended, and you're gonna breathe like this. You cannot learn that skill with the load so high. So you got to bring the load down so the skill gets easier, so you can actually conquer it.
yeah.
So it's like anything, right?
What would you say is the worst exercise that people are doing? Like the most common thing that you see as far as like exercise.
Yeah, that's an interesting question. The thing is, as a PT, we were supposed to say, as like a sporty PT, we were supposed to say, is that there's no exercise that's really like bad. Like you should be able to do anything. Because I've taught some people some exercises that look like I wouldn't even share them on social media because I know I'm just gonna get like roasted. But like I know I could defend them, but I don't want to go through the process of being like, oh no, this is a safe neck exercise. You should do that. Like I do like neck extensions with weight on my head, or I'll have people like, I'll say I do this only, but like you'll be like on the table and you're like rolling your neck. You know how like Mike Tyson used to,
Yeah.
and he's like got the thick neck.
Yeah,
Like
yeah.
sometimes you gotta strengthen the thing that hurts, and you can't do that unless you take some exercises that look risky. But like everyone's so scared of training their neck. But like people need that. Boxers need it, football players need it, concussions. Like you need to do stuff like that. But that people don't do that a lot. I think the number one most basic exercise that you see people doing wrong that we all learn immediately that's super basic would be the like 45-degree incline like back extension machine. And typically, a little bit more often with women, but also with guys, is they'll put the thing really like high, like it'll be like underneath the belly button, and then they'll just like extend like a ton, And then they'll end up having pain. It's like, well, it's probably because like you're really extended all the time. And then you're doing like loaded back extensions with your spine all the way extended and extension already hurt. The thing is, I do that exercise, but I do it like consciously, like because I want to work on my erector spinae and I want to Jefferson curl it up, which is the thing I mentioned earlier, where you're like snaking up. And you can do that with like weight that's tolerable and you have total control over.
Yeah.
But it could lead to some anything that seems dangerous. It's because it's just a skillful exercise. Just got to be careful with progressing it. But you can do any kind of weird looking exercise as long as you're doing it. As long as you're doing it with good form, and you can once again keep the skill above the load, just enough where you can progress upwards. It's not like like a push up or something. Like, you could do those wrong too. People do those with their arms all the way out here, and they get like chest, neck, shoulder pain. So anything can be made into a horrible exercise. Some things are just easier to feel horrible.
Yeah. So just being intentional, understanding what the purpose is. At that point, you're in control, and if you're doing it right, you're good to go.
Yeah, which is not an easy skill. That's
Right,
why
right.
like we exist, right? Or like why trainers that are good exist, because you got to make sure that they're not like it could be daunting. You probably talk to a lot of people who are like scared. I mean, imagine like a normal person going to elevation and trying like an exercise that isn't super basic. They'd be like, they might think that people are like, what the hell is this guy doing? You know?
Yeah.
Because that gym is full of massive people.
It
But
definitely is.
But they're not as unsupportive as people think.
You know what? I think it is once a person acquires a level of discipline, whether it be bodybuilder or any type of martial arts or anything like that, you kind of like start humbling down a little bit because it's like you know your power, you know what you're capable of, and you don't have to show it to the world. That's at that point. So you become a little bit more easier to talk to, easier to give. If somebody asks, "Hey, how you do this?" You're a little more open to it because you kind of know how to do it.
Ironically, right?
Yeah.
Because they look intimidating to people.
Look intimidating as shit. The average person walks into that gym and tries to put something out, it will look very intimidating. You'll be taken back by it for sure.
Yeah, I've had patients in there that want me to teach them stuff. And they're like, I'm looking an idiot. Everyone hears. And I'm like, trust me, like
Right.
they'll probably be like the first people to help you if you just ask them.
Yeah.
It's like the mid range. Yeah, like with martial arts is a good example. I hear that example all the time. Like people who are really trained are less likely to get into like a crazy bar fight. I've heard
100%.
it happens, and when it happens, everyone talks about it, like
Yeah.
Conor McGregor type stuff. But like in general, doesn't it like humble you? You don't want to like.
It absolutely does. And back to playing football. Like I wanted to ask you a question. I played football for like 6-7 years when I was from like 11 to like 17, 18 almost. And I did a lot of neck exercises, right? So one of the neck exercises that I like doing that I try out is the one I put the roller, the one where you kind of like roll on your legs, your quads and stuff like that, just a foam roller. I put my head on it. I hold both hands, and I allow just like for support. I start with both hands, and I'm rolling my neck side to side, back and forth. A very slight, like almost like 1 inch. I'm not going all crazy because you can't roll too much on it. And then after I do it a few times, I take off my hands and I'll roll with just my neck, and it feels great, man.
Yeah.
Yeah,
And it looks risky,
solid.
but it's like.
Yeah, it's solid. And
Yeah.
people look at me like I'm crazy when I'm doing that.
I know, but then you can show them that video of Mike Tyson.
Yeah.
And am I thinking about the right video? I'm sure everyone
Yeah.
did.
Mike Tyson.
Where he's like,
Yeah, going. Well, I think the video you're talking about is where he's with his feet. He's just keeping his feet. He's elevated, and just on his neck, he's going round and round, man.
mm-hmm.
Yeah, like literally, man. And that
Oh yeah, he's like
Yeah.
running like a dog in a circle almost.
and he's like his
I didn't
neck
even.
is
Yeah,
like
it's
that
even
thick.
crazier than I remember. It's even crazier than I remembered.
Yeah.
Because I have patients do like just one aspect of it. I'll have them like head in my little squishy table, and they'll just kind of like roll forward.
Yeah.
I gave it to a guy who had neck pain, who would have been so scared of that. But after a few appointments, I'm like, try this. Because it's tough to get like neck-oriented exercises that aren't like weird to set up. Because I get like a band, like a thick band around a pole.
Mm-hmm.
I'll have them do this. But it's just like, it's weird because it's open kinetic chain. You're like moving your head in space, and you kind of got to line up the band to make it work.
Yeah.
And the plate and the head thing hurts people sometimes. You got to put like a cloth on it, and then you look kind of silly. But like the one if you're like rolling on something, you can use your own body weight. You just got to be careful, of course. But it's specific adaptations to impose demands. The said principle is that is. You can end up doing some crazy shit and it's like not painful at all.
Yeah.
Or it doesn't hurt. It's not even risky. It's less risky than someone who just started working out that does like a bicep curl with horrible form and a heavy weight.
Yeah.
Because your skill is still above the load, you know?
The chiropractors, do you deal with any of that type of therapy at all with people or no?
So yeah, I mean, and I specifically will do. I have some manipulations that I do. They're not chiropractic manipulations, but they present similar. Like they're like high velocity, low amplitude thrusts, we call them. And I used to not do it at all, but I was like, damn, it'd be a good thing to add in because when you crack someone's neck or upper back or lower back, it provides you a window of mobility and of pain relief to a patient where you can then make them work harder and build strength. So like even for shoulder stuff, you could crack someone's neck and then it can make their shoulder pain decrease. Like rotator cuff pain can reduce, for 15 to 30 minutes after you do like a cervical manipulation. We call them manipulations. I think chiropractors call them adjustments. And I do also have chiropractor friends that I trust a lot in Brickell. They're called the Brickell Chiros or On the Go Wellness. They're like my friends, and they're really good, and their customer service is awesome. I love working with them. It's nice to find good referral sources,
Yeah,
of
course, with everything.
But if someone needs those basic manipulations, I do them, and it allows me to maximize the other components of it. So I get to like, okay, now that their shoulder feels better because I cracked their neck, I can start doing like shoulder exercises that were hurting a minute ago. You do the same shoulder exercises 2 minutes apart with a manipulation in between, and they can do it with like no pain. So, but it's not going to last. So I use it as an opening I'm used as that opening to strengthen them, and that's how I try to solidify the differences. So, I have a cervical one, so your neck. I have a couple thoracic ones and a couple lumbar ones that I do. And there's one for the elbow that I do sometimes that is like kind of random, doesn't always work. But chiropractors know a ton of them. And there are good ones and there are bad ones, just like with PT.
Yeah.
So I think when I first started out, I was kind of a hater. But then I was like, wait, like step back. Because obviously there's a lot of good to it. So when I met these chiropractors and I saw what they were doing for my patients, I was like, good, I have a good referral source to a chiro for people that want that kind of treatment. I got them,
Yeah, that's cool, man. What's your favorite thing about being your own boss? Having your own business.
I think I think it is. It's like, I think I like scaling it a lot because you can, first of all, whatever you want, you can try to make happen, which is cool as long as it relates to the field you're in. So my product is rehab. So like now that I'm like I was saying earlier, I'm getting into like I'm getting into that part where I'm like scaling it. And when you find it, you kind of end up like Plinko, you get pushed around and you end up in the thing that you're like, oh, this is a good business opportunity, So I ended up like that with some of that in-home stuff all over, hopefully America someday. And I was like, well, I think this could work out and positively for me because it's just taking my business and instead of making it people coming into me, I get to maximize my profits instead of giving my time for it. And I would like to kind of mix the two. So my favorite part is being able to, it might be two things actually, and they're totally unrelated. It's being able to scale it and make more money that way. But it also is the other aspect I liked about doing PT on my own, which is like the personal connections I get to make. Like I have this weird thing where I like when I'm like walking around or I'm out one night and I see someone that I treated or like they know me. And it's just kind of cool because like, oh, I helped that guy. And like, now I know him. And like, he's my friend now. And like he came into me as a patient and he's like, Rob. So like he likes me. And I helped him, and I met like a friend out, and it's like you're making connections. Yeah, it's kind of I like that aspect. Some people get tired of it. I mean, when you're in the gym and everyone wants to ask you questions about stuff, sometimes it gets annoying. But like in general, I do like the aspect of like being a member of the community. So that's the part I have down with my clinic, and I'm not too worried about making that into a massive conglomerate. Because building out with a bunch of therapists and physical locations and all that rent and like dealing with like the operations on that to me seems kind of like daunting, even though you could just hire someone for that. But there's a lot of training involved. But with the other thing I'm doing, that scalability Just like with anything that you're selling, it's like I'm selling a product online with that, and the product is therapy.
Mm-hmm.
So I like that. I like combining the two.
Yeah, yeah,
They're totally different from each other, but
absolutely.
they're both one-on-one. So I don't feel guilty about it.
Yeah, and it's very cool, man. It's very cool to watch like a young successful entrepreneur who is offering services and is really great at it, but also building his own empire within, the therapy
Yeah,
industry. You know
yeah,
what I'm saying?
yeah.
So it's very, very cool to see that. What's success to you?
Ooh. Oh, your questions are good. You're not even reading off anything. You just know what to
Well,
ask.
I'm just listening to you.
Yeah. No, listening is a freaking skill, bro. Listening is a skill because it's hard nowadays. It's like, with our 5-second brains from Instagram, all that stuff. Success to me would be like having a large. I think it'd be like the scalability thing I was talking about, like growing that to the point where it's profiting a lot, and I can reinvest that and just keep growing that. I don't believe I want to ever sell my company, but that's what everyone says.
Yeah.
Maybe they would if someone, you never know. I could keep growing it. It could become really successful. And then some people could offer me money to trade it out. But I do like working a lot, like to an extent. Like I like doing that part. I don't know if I could retire totally. So I wouldn't say it'd be like to retire super rich very early and just like chill. Because I don't want to, I see some of those people and like good for them. But like sometimes they're just kind of like they're just like being lazy around the gym or something because they already have all the money. I don't know. I want something that I can keep scaling and helping a lot of people in a way where my customers are satisfied and they're getting actually better. And I don't feel guilty about any aspect along the way.
Yeah.
And I can also be relatively happy treating people individually, probably for a little bit more than I'm treating now, just so I feel like it's a good use of my time. And I could probably help the people around me. Everyone says stuff like that, like they want to like pay for their family stuff. I would like to pay off certain things for my parents, and that'd be sick. I've never talked like this. It's weird to think about that stuff, but that's a big aspect that you don't really think about, like being that person to someone. It's like pay off things for people that need it, but I don't really think about that a ton. But when I'm stepping back talking about it now, I'm thinking about it because now it's getting to the point where I'm like, if I could really, you look forward and you could see where you could go with it, and I'm like, I could have enough money where I could start like helping people around me. So we'll see.
Yeah, I mean that's super dope, and I totally agree with the whole like retirement thing. I'm like, I don't even think about that. Like it doesn't even.
Nah,
I'm like, no, I just want to continue. Yeah, keep going. I got my foot on the gas, and I'm going all the way. Actually, the idea itself just kind of like just puts me to like, what the fuck do you do when you like no?
it's kind of depressing, bro.
Yeah, it is
I'm
depressing.
like, what?
Yeah. It's not so much depressing as much as it is like, well, okay, it's like I'm here, I'm into my mission, and I'm going all the way with it, man. That's just what it is.
Yeah, because you could truly, like with your business, like you could be like the place. You get whenever you're like franchising or growing or whatever, you could make like a massive company, and your influence is everywhere. You could sit back and look at it like that's my baby, and it's operating the way that I want it, and all these people are experiencing it.
Yeah.
So you get that little feel like I like when I meet people and I see them and they like what I did and they're happy about it, and you know that you left a mark in the industry.
Yeah.
That'd be sick.
In the world and
right. You get that big. Think about like Amazon, like that's
it started in a garage, bro.
Yeah.
Like it was just oh, I'm gonna sell Jeff Bezos. I think his approach was I'm gonna sell books. It started as an online bookstore.
Yeah, right.
And it was a garage, you know what I'm saying? Like Microsoft garage, like, bro, and then
that hanging sheet with Amazon written on it.
Yeah, and now they're like what, $1 trillion companies? I mean, the highest value companies that have ever existed in the history of man. So you could create anything if you really want to, and is how far you're willing to take it, I think,
Well, that's another. It's like when I start doing the scalable stuff, I keep bringing that up because I like that concept.
Yeah.
Then you start thinking, wait, I could apply this to a different industry because there's certain industries that always need to exist, like maid services, like extermination for bugs and all that stuff. Like all those things have to exist. So if I could just apply it, once I get this down, I'm like, wait a minute, I could do this with multiple things. I kind of like that it's PT because I started it because I like to help people feel better.
Yeah.
Like if I was doing it for like like extermination, it'd be cool. It'd make money that way. But it'd be maybe something else that I'm kind of something that I kind of put my in. And like you're doing it with you've kept it all under your empire roof. So
Yeah,
you get to have your influence over your whole brand like that. And it's not like random other stuff. It's stuff that you're interested in growing that are related to your brand, which is cool.
exactly. And believe it or not, these are pipelines to the brand. Like, for example, the marketing it's needed. And then, with AI and everything changing the world, if you're not on top of it, it's going to leave you behind. So you might as well embrace it, be a part of it, and not like, oh shit, well, I got a lot of stuff going on. I need my own department on it. So I built it. You know what
Yeah,
I'm saying?
right.
Yeah. And then it's kind of like, in a way, it's a bit it's a blessing that I can, but it's surreal. And it's like, okay, well, you know what? I mean, exactly what you said. You can use the tools that you learn from scaling the PT business that you have, because you're like, you can apply that to almost anything. I'm doing the same thing. I'm applying, and it's just learning how to pivot, letting go, and allowing things to work the way they are, and delegating putting the right people in charge. You know what I'm saying? And training them properly from the beginning, and then having all those T's crossed and the I's dotted. But it's systems, and you just got to get smart with the way that systems work, and then I think you pretty much got it.
Yeah,
How do you stay consistent training people in the gym? I mean, and coming every day, and things like that. But like you train yourself, so
Yeah,
how do you
right.
how do you stay consistent? What are the tools that you use to stay consistent?
I the I mean the delegation component saved me because I have those two assistants that I hired.
Mm-hmm.
And before that, I was like, I remember I was like within a month of like panic attacking. I was like, I can't tolerate this. But then delegating some of those tasks for my business that were tedious, like what's the craziest thing? The worst thing was calling insurance companies because it felt like, what the fuck am I doing? Like, what is this? This is not what I signed up for. So I was like, wait, I could just teach someone to do this. It felt weird getting an assistant. I'm sure you had the same experience when you first started doing it. It was like,
Yeah.
it's like, damn, like I gotta like give someone this whole task. Are they gonna do it right? But it's like, wait, I could literally make like a 4-minute video on Loom of me describing something and then like navigating my computer and send it to them and be like, figure this out, put it in your manual, show me when the manual is done, and then do it forever. That's like, it's so easy that way. And I learned that from a course that I took called the 10,000 Small Businesses course that you're way too big for now. But it was hosted by Goldman Sachs, and it was like 16 or 18 classes long, and they taught you certain things. And some of the stuff was really helpful, and some of the stuff didn't really apply. But the first lesson they taught us was about delegation, and that's when I learned. I mean, I already knew it, but I was like, damn. And then I saw the other people that were there, the other business owners, and they had delegated effectively with their assistant. And I was like, damn, I should consider this. So then I gave tasks. And then now that my assistant has like an 86-page manual, that it's super tedious, but like she already knows everything. It's just in case we hire someone else that does the same thing for
Right.
another.
Right.
And so she's chill. She knows the deal. And all that, like I can just tell her to do tasks, and then it lets me like work out in the gym at the end of the day and not be like worried about getting something done, you know? And I kept taking stuff off my plate. And that's been the largest difference in my stress of balancing work and life. So it's kind of a random answer, but that ironically is the top thing, was like delegating stuff effectively to my assistants. But yeah, balancing everything else, like I try to just organize my schedule in a way where I can like hit up certain spots around town. It's the gym in downtown, the gym in Miami Shores, and the college. And I refuse to treat patients from their home unless they're paying me like the cash pay rate at home, which is expensive. So like it has to be worth my time. I've really learned to respect my time as how much I should get paid. You know what I'm saying? Like
Yeah.
if I'm,
Yeah.
and then when I started, I would treat people from all the way in Hallandale for like $100 just so I could like get the name in. Then I was like, I could delegate this to other therapists. So delegation is the number one thing,
Right.
which you know too.
Yeah.
You get people with massive companies that are just like we see it in the gym. Those people that have like a lot of money that they just seem to have delegated tasks. Hopefully that's a real business, but like they have time. And it's like, how'd you do that? It's like, oh, they just have people that run stuff for them and take care of it all.
Yeah, I mean, you look at people like, for example, like we said, Elon Musk. You look at Jeff Bezos. I mean, Elon Musk has how many companies that are all multi-billion-dollar companies? So you can imagine that his delegation skills have to be top tier because it's not just him. You can't build empires just by yourself. It is a team effort. You know what I'm saying? So absolutely, the delegation has to be on par, and the training behind it has to be even more tight.
Yeah, right. And you get to the point where you're hiring people that make rules for other people to hire people to create operations and tasks for other people. Like he's so far removed from like you know what I'm saying? He's
Yeah.
like 10 levels removed from like a worker, like a manager at one of his plants probably. Because if he was thinking about those things and he's got to think of everything, there's no way.
Absolutely.
So he's at the delegation. People think that it's just like you're running everything. Like there's no way he'd be able to do that. He'd have no free time at all.
No, yeah. But you know what? He sleeps in his company sometimes. So
I've heard that.
So it's really interesting to actually wonder where he's at.
Yeah, like you think someone with that much responsibility and power, like they're just like sleeping at night. Like, bro, I think about the president. I'm like, dude, like, I mean, without getting into specifics, 'cause, like, let's say we had like a president that, whatever. Let's just say like how long are they sleeping for? Like, there's all this stuff going on in the world. Like, you got to get up and freaking work.
Yeah, and
There's so
what?
much responsibility in these people. They're delegating their stuff too.
Absolutely.
Obviously.
I find that the better you can take, the more responsibility you could put in your plate, the better you can handle issues. It's almost like at some level, the less you need to sleep, because the more you're on your mission, the like I wake up, I'm like, all right, what's next? What am I gonna hit next? I'm not really like, oh, let me sleep in. I don't want to wake up, So
Yeah.
it's like you don't need it as much, I think, as I mean, going to not to get too holistic, but the vibe aspect, the vibration, and the higher you vibrate, the more you're able to handle, and you just kind of like just plow right through. You
Yeah,
know what I'm
right.
saying? Yeah.
Yeah, no, the
I
more
find that
that-
in my life.
Yeah, the more you believe in your brand, and the more that you the more that you appreciate what you're doing, and where it's actually once that connection happens, like, okay, I'm doing this, and it's gonna end up there. You're like, ooh, this is exciting.
Yeah, yeah.
And then you make more money at the same time too, which is extra cool.
Yeah.
Like, make money doing it, and you're helping more people, and you're creating something that people are gonna like. It's like, damn. Because I remember I was a little bit disconnected when I started. I wasn't like so motivated because I was like, what am I doing? I was like focusing on certain things that weren't worth the time. I was dilly-dallying with like wastes of time, patience, tire kickers, people that aren't going to buy the product. And I'm like, wait, if I like back up from this all and create systems, then I can reduce those stressors and focus on the growth of it all. And it almost feels more invigorating, and I'm more enthusiastic to work on the stuff
Yes.
when I'm doing it.
Yeah, because that pulls you, not pushes you. So it's like that pull is like it's a fuel that never burns.
That's a good way to put it, bro.
It never runs out because you're
like,
being pulled, right? Rather than being pushed, but like, oh yeah, I got to do this.
It's a gradual change in your mindset, right?
Yeah.
Like, I bet your like neurons are connected differently now than they were.
100%, man. I was just, I'm like we spoke about before. I was just a kid from Queens, and I'm like, I have a daughter early, and I'm just in survival mode, and like fucking, going from like getting put in the hospital, fighting in the streets, and all kinds of shit, leaving New York, and leaving all that behind, and now I'm like, in a totally different place. I'm like looking back, I'm like, wow, I gotta do my part and share what I know, because if I don't, I won't be able to sleep at night. You know what I'm saying? So I'm in that, yeah.
That's crazy. Most people that have kids young are not able to, because they're so focused on that.
Yes.
But you're able to, like, it motivated you.
It motivated me, and it put me in a place where I had to burn all the boats. And by burning all the boats, I really was like, I gave myself no other option but to like kind of like get rich or die trying, so to speak. But it's not really about getting rich. It's really about like completing my mission. You know what I mean?
Yeah.
And I mean, this is really like the whole the philosophy of the podcast is really empire is the way, is really building your empire from within. And it's because mine was so destroyed that eventually I was like, oh, okay, that's what I have to do. You know what I'm saying? Like, so I think overcoming put me in this path of like, this is my mission. And I now it's like, I want to add more responsibilities to my plate. It's because I enjoy them, I can handle them, and because I actually, it's the battle that I enjoy.
You kind of gave yourself like a blank slate, almost.
Kind of, yeah. I press the reset button
Yeah,
for sure,
yeah.
and I learned how to press it in different ways. So now, like, I can reset whenever as I want to.
Yeah, like you could probably like you God forbid you could lose everything and then just rebuild it.
Yeah, I'm cool with
It's
that.
like
I'm
you
not
have the
worried
tools
about
here now.
it. Yeah.
Or some people, the mindset of like, like I lost everything, which is obviously terrible and sad, but like they wouldn't be able to recover it. People declare bankruptcy on things, they reset, things go super wrong. There's things I'm sure that happened to you in the past few years that
Absolutely.
you're like,
Yeah.
oh my God, that's a huge loss. But you just motivate yourself with it. I used to like let myself get down when little things would go wrong.
Mm-hmm.
But now sometimes I just look at them like objectively. I'm like, all right, whatever. Like I guess we'll have to just adjust. I'll make it work eventually.
Yeah. What's the solution? Jocko, you ever listen to Jocko's podcast?
Not enough.
No,
but I know about it.
He talks about extreme accountability.
I know that.
And it's like, man, even if it's somebody else's fault, so to speak, I make it my fault, and it just forces you to level up by any means. I've adapted that into my thinking for the last couple of years. So that's helped me. That helps me extremely to pivot really fast.
Because we were saying earlier when we were in there was like how when something goes like wrong or someone's complaining, like you have to, or you said it here too, is like you have to almost like let it go through you and think, how can I fix this? So like if you're worrying about placing the blame on someone else, then you're not going to be able. It's going to almost like distract from that concept because well, it's his fault.
Yeah,
I got to talk to him about this, yell at him for it. But you can still talk to him about it. But like if you just like take it on and fix it, then you handled it. You just don't let it bother you too much, and you can talk to maybe the employee who made a mistake, and not act like, well, it's I would be there for him.
Yeah. It's almost like if you were a filter, like a coffee filter.
Yeah.
And you're holding on to all the info, you're holding on to like that excess, and it stays in you. And I believe that's probably what causes most of the diseases and all the shit, because you're holding on to it. You know what I mean? Like you said, in almost a month, you had that panic attack. It's because you're holding on to everything and not releasing it. The extreme accountability, I think the magic of it is that you watch it, you hold it, you don't really hold it, you just release it right away because you're finding the solution right away. You see what I'm saying?
Yeah. You're so like dealing with it.
It passes through the filter to the point where that filter is always clean, no matter what.
That's a good point.
You know what I'm saying? That's kind of like a visual.
That is a good way to put that, because it does. You don't build up. Like
you don't build up. Yeah.
You're just like, okay, how do we address this and move on from it quick? Handle it.
Exactly. That's worked for me. It's working for me so far, and I could see how much better it can get. So I'm definitely in that path.
Yeah, because if you apply that to any situation when you're scaling it, then you can eventually, those situations that you're just like figuring out, they could be higher risk and higher reward. It could be like $1 million idea that you're like $1 million issue, and you're like, and you just move on. You think of a new plan, you pivot and go. And then you can just, if you keep focusing on building your empire without having to like worry about like, oh no, I lost $324. Like, okay, let's just fix it. Like it was sometimes with my billing and stuff, like I'll find out that I like treated someone like 30 times and like we didn't get paid.
Right.
I'm like, this will never happen again.
Yeah.
It's like a $4,000 error. Yeah. 40,000. Never mind, that's huge. It's like a $4,000 error. I'm like, okay, it's not like, it's literally not gonna make a difference. Because if you're going to have a big, successful company, me making a mistake that was a $4,000 issue, I have enough money saved up where it's like not a huge issue. I'm like, I want that $4,000 thing to be no big deal.
Yeah.
Yeah,
absolutely.
Like if you went into some billionaire's account and somehow like perfectly extracted $5,000, they would be like, they wouldn't even blink. Like say if Bill Gates dropped like $1,000 on the ground, it wouldn't even be worth picking it up.
It would cost him
his
more.
time bending. Yeah, you know what I'm saying? No point. He probably does though, because it's just human nature. I want about 5,000.
What's the hardest challenge you ever had to go through thus far
with the business?
No,
in life.
In life.
Oh my gosh. Okay, I'm trying to be like Jordan Peterson and think for a long time before I answer.
Which is fine.
I like when he does that. Yeah. I'm like, oh, you don't get much of that.
I think that's normal. You should employ that because it gives you a chance to really think and say something that's meaningful, right?
Yeah, because I can start bullshitting immediately and just give some like the 30th most stressful thing that ever happened to me. When the most stressful?
The most challenging.
Challenging.
Mm-hmm.
Oh my gosh. I mean, it was, oh man, I think it was business related. I mean, there was a point where I had a lot of stressors going on. Like, I had some like personal stuff kind of at the same time that I was trying to manage the business. So it's that buildup of multiple issues, like personal and business, that led that like then it's just like over like the filter filled up and I was it was so much. And it was like so bad that I would like wake up stressed. Like I didn't need coffee at all. Not that I should, I shouldn't need coffee, but you know what I
Yeah, yeah, yeah.
mean.
You already woke up with
Yeah, do you
the
ever get that when it's like
yeah,
that
yeah,
much when you're that like scared? Oh
yeah.
my God, bro. And that was for like that was for like a few months, and then I was like, oh damn, you could save a lot of money on buying coffee if you just are extremely stressed all the time. I was like, this is a level of stress that gives me cancer.
Yeah, I don't know if I would recipe that
Straight
to
to
somebody
$6 a
else.
day. Like, here's my new coffee brand. I'm just gonna make your life really stressful, and then
Yeah.
because there's like the use stress, right? There's the stress that's good, but like there's other stuff that was going on. It was just like I was like worried about too many people and things, and I was like,
Yeah, yeah.
and yeah, the business definitely contributed to it. It's like anything that you ask me now that involves like in your life or the things about you, it always involves my freaking business now, which is kind of cool. But sometimes I'm like, damn, my whole self is represented by my business. But it's not really like that, but it's, you know what I'm saying? Sometimes you get kind of like, I'm like, damn,
You know
it's
what
not a bad thing necessarily.
you know what I say to that? Like when I usually say I speak a lot about like how business is so important because it's your echo to the world. Like your business is a representation of your mission in this world. So it should be tied to you, and
Right?
it should be your because that's like your mission, bro. And your
Yeah.
business is a representation of what you created, your word to the world, like your own accountability, and it's the outcome of what you're building. So it should be a tie. You know what I'm
You run
saying?
it kind of like with the same morals and values that you do in real life for the most part.
Yeah, for sure.
Like you try to make it like align with the way that you are.
Hmm.
It's like I hope my business comes off as super like friendly and like customers. I'm customer service oriented, I like to say. That's one of my biggest things. And in real life, I'm kind of like I like to make friends and be friendly to people. Like, I don't think it's like that fake kind of stuff. I think that sometimes when you start off interacting with someone, you got to be kind of like nice and just let conversation flow. I try. It's not like a standoffish, like swagger based bullshit business like I see sometimes. It's kind of like it kind of represents me. And I mean, come on, you sleep 6 or 8 hours a day, and I work in my business from like 8 a.m. until like 8:30 p.m. sometimes with breaks in the middle. I drive to patient's house. It counts as work though. I mean, you're still driving. I'm thinking about it. So it literally is my whole like. I mean, how am I going to ignore something that's 12 hours a day of my life? Like yeah, it's
You
fucking.
can, and it's your mission.
I
So
mean, otherwise, if you're a regular worker, you work 8 hours a day for someone else, which is fine. But like 9 hours a day, and you get home, it's been 10 hours since you left your house. You slept for 8 or 7, so there's only 7 other hours in the day, which probably doesn't even feel like that for most people because they get home and it's like now you got to have a hobby in that time. Like I
yeah,
just replaced the hobby time with I put that into the work. When someone asks me, what are your hobbies? I'm like, sometimes I'm like, damn, like I guess weightlifting. I try to go to yoga a few times, which is kind of funny, but it feels good. It's like a change up. It's like relax. It
right.
lets my brain. It might not end up being yoga, but I do a lot, but it does let you decompress because everything I do is hype. It's like work, and then I listen to like house music, like when I'm driving and stuff, and then when I work out, I'm lifting heavy. So there's not much like, and
Right,
just that I was like,
right,
well, yoga could be good for that. I don't know if I'm gonna stay with it. I did a couple times. It's kind of fun. I feel kind of weird there. I feel like different, but
yeah.
it's a good thing.
You
But
know Dorian Nix? No,
who?
Dorian Nix. He
No,
started a yoga program. I just had him in the pod. Like he's doing something really cool.
in
The yoga.
Miami.
Yeah, he's bringing them to Wynwood. Plug to D Nix, by the way. But yeah,
Oh, wait a minute.
he's doing a yoga. Yeah, like he's doing a whole
What's
yoga.
his Instagram? Isn't it like
Yeah,
Dnix?
yeah, yeah. He's
DNICKS.
he's
Yeah, he's my
doing.
friend.
Oh, there you
Well,
go.
I guess I never knew his name was Dorian.
Yeah, yeah.
I should have known his name was Dorian.
He's doing that program. I think he's got Angel there and a couple of different people, but he's doing a program in Wynwood. He had a couple of people show up, like a lot of
I'll have to
people,
talk to him. Yeah,
yeah,
he
it's
used to
really
go to
cool.
Elevation like 3 years ago,
Yeah, yeah.
and he has braids.
Yes, yes.
Oh, nice. I'll have to talk. I didn't know he was still here. I thought he moved away.
Yeah, but he's doing it either way. Point was that the yoga, he's doing like a very specific yoga classes now.
Oh, yeah, he was. Yeah, he was. I remember he was always talking about yoga. He was a teacher, like a trainer with it.
Yeah, yeah,
Yeah.
yeah. So he's doing that. You might want to check it out though.
No, I'm going to.
Yeah,
I totally forgot about that.
yeah, yeah. I'll send you that info. So how did you overcome that challenge though? Because you got into that place where you were like really,
Yeah, right.
yeah, really big with the work and personal life,
Yeah,
and it
right. How
was,
do I
yeah.
overcome
So
that?
how did you overcome that?
Um, I worked with the personal. Obviously, I had to work with and figure out the personal stuff, and then I made that calmer, which reduced a lot of the background stress, and and then it allowed me to focus more on the right things at work, which made me more of that thing that you mentioned earlier, like the pull thing instead of the push thing. So I was
Mm-hmm.
like,
Mm-hmm.
I was able to refocus myself that way. But I guess the simplest way to put it would be like, yeah, I had to like deal with the personal stuff. It wasn't anything crazy. It was just like enough to be stressful. You know what I'm saying? It's like sometimes, with things get stressful. So then I had to just make sure that that stressor was reduced, and I had to manage that one better. Yeah, in your personal life, you can use that stuff as like you can use business concepts with that too. So I was like how can I control the situation just like I might do in a business, you know? So that's what I did. And then I was able to tone that down a little bit. And then the business stuff, I was able to focus more and then be excited about being pulled up into more success, I guess. And now it's like eustress. I think
Good.
lately business has not been, the more the scaling thing has been working out and the less I've been worried about the one-on-one stuff, the more I've been kind of pleased with how I feel about growing the business.
Nice. It relieves the pressure and you just kind of like get to do something you love without having to worry too much about the financial side. Is that what it is? Or?
That's part of it, yeah. And then also the day in, day out, like in facility, managing every little person, the delegation stuff, that helped too. So now I can just focus on growing something as opposed to focus. They always say working in it versus working on it.
Yeah.
That's what I'm talking about. Like I'm working on it more and I can see a path to victory that's way less shitty than other ways, you know? So we'll see if that works though.
Path to victory.
If it doesn't work, I have the tools like you.
Yeah.
I can lose everything and start again.
Yeah.
I'm getting excited because now I can start applying it to other things. Maybe I can make my brand like you. Not like yours, but like other
Absolutely.
things that have to do with PT and rehab. And I can apply those concepts. I'm learning something today and grow other aspects of it. So we'll see.
Amazing. Whatever I could do to help.
Oh,
So if somebody wanted to, like, for example, have a one-on-one with you right now, do you still have time? Are you still taking
yeah,
bookings?
definitely. Yeah. I do that. Yeah, I have my Instagram is Dr. Rob Polzuk, DrRobPolliszuk is my Instagram. My website is physiologicspt.com or the same thing, drrobpolizuk.com. It's pretty built out. I have like 80 blogs that I've written. I have a bunch of information on what I do. I have videos, I have testimonials, all that stuff. So you can kind of learn a little bit.
Yeah.
So, and yeah, that's they could come right to the gym. They could come up to my office. If I'm in there, I'll say hi. But I'm always willing to work with anyone anyway. Any kind of, whether they need treatment or they want to connect or we can collaborate, anything like that for sure.
Amazing, man. This has been a lot of. I'm learning a lot from your perspective because there's a lot of things as far as therapy that I have no idea about. As a matter of fact, I want to come see you for that scapula.
No, bro, I'm
situation.
down. When you mentioned that, I was like, here we go.
Yeah,
I got you.
for sure. Any advice to the youth right now? People going to college, getting trying to start a business, and they're like a little scared.
Yeah, right. I mean, with first of all, with PT, I'd say you got to be careful. Look how much college costs. Think about what you want to do after you graduate because grad school is really expensive for PT. And if you want to work as a regular PT in an office, you got to really love it because you're going to be making like 70 to 80K a year. And your college is going to cost you a little bit more. And it kind of does burn people out. So you got to make sure that you're set up and you have these standards. So you don't want to get sucked into like crappy positions. My general business advice It's crazy me giving a business advice. I never thought of this. I guess would be like, sometimes you got to step back and work on it rather than in it, which is what everyone says, but that's a huge thing. And delegation was the biggest thing I've done in the past like 3 years. So if you ever get to a point where something seems like it's a little bit too much, or it's like getting a little bit stressful and it's easily delegatable, there's assistants online you can hire for like any kind of price, relatively cheap. As long as the company is like a good one and honorable and they seem happy, then take care of your assistants and give them bonuses and all that, and you can delegate and grow way easier. So that's my advice for those concepts, at least.
So either way, today I learned a lot. I appreciate it. I'm gonna catch you at Elevation in the gym.
Yeah,
'Cause I
bro.
want to come see you for that.
Let me know.
And thank you for being a part of the
No
pod.
problem, bro.
Thank you so much.
It was
brother.
awesome. Thanks.
Yeah, and as you know, all day, every day, Empire is the way.